All right, today let's talk about a Chinese herb that can be very helpful potentially for metabolic syndrome and or heart disease. And we say and or because metabolic syndrome is often a precursor to heart disease or a promoter of heart disease. And so recent research suggests that Chinese skullcap is the most common name that lay people may know it by, because there's supplement forms of it, and most of the time it's called Chinese skullcap on the supplements. But the herbal name is Scutellaria baicalensis, and the active ingredients are baicalan and baicaline that have the most research behind them for us. So we're going to look at two studies today that show usefulness against metabolic syndrome and against heart disease. So we're going to jump over to the studies to dive in deeper. And here we are looking at the first of the two studies. This is from 2021. And this paper is entitled Promising Influences of Scutellaria baicalensis and its two active constituents, baicalan and baicaline, against metabolic syndrome. So first we need to know, what is metabolic syndrome? And metabolic syndrome is a constellation of symptoms made up of central obesity, so too much fat around the midsection, which we've talked about before, that there's two kinds of fat. You have subcutaneous fat, which is the fat in the booty and breasts, the fat under the skin, and there's visceral fat, which is fat around our organs in the midsection. And the visceral fat has been connected in the research to increased risk of heart disease and type 2 diabetes and cancer and all kinds of maladies. So too much fat around the middle is a contributor to metabolic syndrome. And that could include not being obese overall. So even if you're sarcopenic obesity, or skinny fat is the lay term for that, you don't have to be obese to have an obese body composition. So too much fat around the midsection is a risk factor. Insulin resistance is a risk factor. If your cells are resistant to insulin, then you don't deliver sugar to the cells well, and that sugar stays in the blood, and that's pro-inflammatory and substrate for bad things to happen. High cholesterol and high triglycerides are components of the metabolic syndrome, as well as high blood pressure and low HDL. So you don't have to have all of these factors to be diagnosed with metabolic syndrome. You just need any three. And so this paper was looking at, how does Chinese skullcap, or baicalan, baicaline, Scutellaria baicalensis, whichever name you want to use, can it be impactful on metabolic syndrome? And they find that indeed it has anti-diabetes effects, anti-high blood pressure effects, anti-high cholesterol effects, anti-obesity effects. So something we should know about, because if we wanted those effects for medications, we would need a different medication, or 2 or 3 for each of those things, right? For the anti-cholesterol effect, a statin drug. For the anti-diabetes effect, if it's type 2, it'd be metformin. Anti-obesity, there's a bunch of them. Anti-hypertensive, a bunch of them. Blood pressure meds, right? So if we can use one thing that is an herb and not a potentially toxic pharmaceutical, that's very beneficial. And as we'll see later, if we combine it with lifestyle factors, it's even more beneficial. So let's dive into a little bit of the nerdy stuff first before we see some cool pictures. So we just talked about what metabolic syndrome is. Metabolic syndrome is determined as one of the most well-known risk factors for type 2 diabetes and heart disease. Metabolic syndrome increases the probability of occurrence of type 2 diabetes by 5 times and of cardiovascular disease by 2 times. So it is a risk factor for those two things. And as we all know, cardiovascular disease is the #1 killer in the United States. And so if we've got issues doubling our risk for that, that's not good. Metabolic syndrome is also involved in development of non-alcoholic fatty liver disease, gallstones, systemic inflammation, and reproductive disorders. And an inactive lifestyle and excessive food consumption promoting abdominal obesity can be considered main causes of metabolic syndrome. So there is definite lifestyle factor contribution to this. This is a metabolic syndrome is a choice. It may not be a conscious choice, but it is driven by lifestyle. And so the first point of prevention, therefore, I'm glad the authors say this, is lifestyle modification and weight loss. So if you're not moving, get moving. If you're eating too much, eat less. If you're eating poor quality, eat better quality. You know, if you've got too much weight on, lose it. If you're not sleeping well, I would add sleep is huge, because poor sleep promotes insulin resistance, which is one of the factors in metabolic syndrome. So we've covered all kinds of lifestyle factors that are likely involved here in previous videos. So specifically the Chinese skullcap, what does it do? Well, studies have shown that it has antioxidant, anti-inflammatory, liver protective, brain protective, anti-cancer, antiviral, and antibacterial impact, which is huge. It's like, hey, this could do everything, right? And specific to the metabolic syndrome, we said earlier, anti-diabetic, lowers cholesterol, helps prevent obesity, and promotes optimal blood pressure. So that's all the words. Here's the picture of it in nature. And if we want to see it all the nerdy stuff put onto graphics, here it is. So, you know, how might it reduce blood pressure? Because it decreases pulmonary hypertension. It decreases high blood pressure in the lungs. That's a big deal. It decreases intracellular calcium levels. It improves intestinal integrity. So you want to help your gut barrier. That's one of the mechanisms by which this works. It improves your gut microbe production of short-chain fatty acids. Well, short-chain fatty acids are fatty acids made by your probiotics that that are anti-inflammatory and promote vascular health and many other positive physiologic outcomes. If we're trying to prevent atherosclerosis, Chinese skullcap decreases inflammation, oxidative stress, two key things that must be there for atherosclerosis to develop. It decreases thrombin, so that's going to help decrease clot formation. It increases the efflux of cholesterol, so basically pulling cholesterol out of the blood, sending it back to the liver. How does it help against diabetes? Decreases blood sugar levels, decreases insulin resistance, or increases insulin sensitivity, would be another way to say that. It promotes balanced gut microbes, so balanced probiotic levels. It increases GLUT4 receptor expression. What is that? Glucose transporter 4 receptors are on our skeletal muscles. It's a non-insulin dependent way, or an insulin independent way, to pull sugar out of the blood. And this is one big way that exercise helps improve insulin sensitivity, is your muscles help pull sugar out of the blood for you. So you don't even need insulin to do that. And Chinese skullcap also increases AMPK expression. AMPK promotes production of ATP and energy and insulin sensitivity, etc. How does it help with obesity? It decreases your appetite, decreases food intake, is a big one. And then from a cholesterol level, how does it help lower those? It directly lowers lipids. The AMPK expression lowers lipids. And there's various other pathways here by which it does that. So, you know, this is one pill or one tincture or one product to help accomplish all of these things, instead of a pharmaceutical for each of these separate yellow boxes. So if you've got metabolic syndrome, or you may not know if you have metabolic syndrome or not, but if you have too much fat around the abdomen, or if your blood pressure is creeping up, or if your HDL is too low, or any of those markers that you have, and say you don't have 3 of them to qualify as metabolic syndrome, but you have 1, well, you don't want to add more to the point that you get to 3 and you are diagnosable. this may be useful to begin now. And again, speak with your primary provider that you work with before adding anything and discuss whether this is right for you. So that's the metabolic syndrome study. And again, the heart disease is part of that. But if we go look at a second study from 2022 here, this is in the journal PMC Complementary Medicine and Therapies. And the title is Exploring the Protective Mechanism of Baicalan in the Treatment of Atherosclerosis Using Endothelial Cells Deregulation Model Network Pharmacology. So important to us is the protective mechanism of baicalan in the treatment of atherosclerosis in endothelial cells. This is a cell in a dish study. So this isn't happening in a human being. They took human endothelial cells from the human aorta and they put them in a dish and they damaged those cells. And then they used the baicalan to see, does it rescue them and how would it help prevent the atherosclerosis? And so from a research perspective, you start with cells in a dish, and then you move to animal models, and then you move to human models. And so before we move forward here, that reminds me to go back to this first study for a second. If we scroll down, this paper was a review. So they looked at a bunch of different studies that use baicalan for the different components of metabolic syndrome. And so these tables here are a bunch of studies they reviewed to come to their conclusions. And most of these are studies in rats and mice and cells. Like I just said, the progression in science is, well, let's study it in cells in a petri dish, and then let's do an animal model, and then let's do a human model. And so in these tables, it's mostly cells in mice and rats, but there's one study here that they did do on type 2 diabetic humans. And so what they did was they gave a water tincture of the Chinese skullcap at 3.5 grams per day for 8 weeks to type 2 diabetics. And what did they find that it does? Results here, you can see it mitigated glucose tolerance. So it improved glucose tolerance. It decreased TNF-alpha and IL-6, which are two cytokines that drive systemic inflammation. And it promoted abundance of bifidobacterium in the gut, which are probiotics that are very important for us. If you look at just about any probiotic supplement on the shelf, you'll see it often has bifidobacteria and lactobacillus in it. So bifidobacteria are one of the most common probiotic families we want to have, and the Chinese skullcap helped promote abundance there, so helps improve gut. Another thing it did was elevate other microbes, lactobacillus and akkermansia in the gut. That's important because lactobacillus help with many things, one of which is antiviral. And akkermansia has been shown in the research to promote healthy insulin sensitivity. Hey, we want that in metabolic syndrome. It promotes healthy lipid metabolism. Hey, we want that in metabolic syndrome. And it promotes healthy body composition. Hey, we want that in metabolic syndrome. So if this can help with so many things, and here's the first or a human study that these guys reviewed that showed that. So that's great to see. So back to the cell in a dish study done in 2022. Why is this important? Why am I going to a cell in a dish? Well, we have to start somewhere. And this ties into other videos we've made recently regarding heart disease risk and nitric oxide. So what they do? They wanted to assess the underlying mechanism of how baicalan helps in atherosclerosis. So they used human aorta endothelial cells. Now, what are endothelial cells? We've talked about this in the past, but endothelial cells are the cells that line your blood vessels. And when they're healthy, the blood flows through your blood vessels smoothly and in a slippery fashion, so to speak, versus it moving through slowly and thickly, and maybe things sticking to the vessel walls and maybe developing into clots and plaques and eventually atherosclerosis. So the aorta is the artery that leaves the heart. And so looking at, how can baicalan help aortic endothelial cells improve in health, then, that would be directly part healthy in a living human once the research gets to that level. So what did they do? They took the endothelial cells and they damaged them with lipopolysaccharide in order to construct an endothelial injury model. Why is that important? Well, we've talked about before, LPS, lipopolysaccharide, is also known as endotoxin. This is produced by gram-negative bacteria, and it's one of the most pro-inflammatory things we know in science. So what they did was they treated these cells in the dish with lipopolysaccharide. Well, that would be equivalent or represent in a human model, a human with an unhealthy gut or a gram-negative bacterial infection anywhere that is producing a bunch of LPS. If the LPS jumps in the bloodstream and it can damage endothelial cells anywhere. Okay, so this is a mechanism that is plausible in humans. So what they found was that the baicalan has 45 biological targets against atherosclerosis. So it means it can function in 45 different ways to help against atherosclerosis. That's awesome. There's not a drug that can function in that many pathways. Most targets were involved in oxidative stress. So a lot of those targets were oxidative stress is a metaphorically is rust. And so if we can reduce rust, we reduce tissue damage. In the endothelial, in the endothelial injury model, intervention of human aortic endothelial cells with baicalan increased the expression levels of NOX4 and NOS3 and decreased LPS oxidative stress generation. So giving these cells baicalan helped everything. It reduced the pro-inflammatory LPS-induced damage, and most importantly to our previous videos, it increased nitric oxide synthase 3, or endothelial nitric oxide synthase. I'll link to the video here, but we've talked about in the past that nitric oxide synthase is the enzyme that makes nitric oxide, and nitric oxide is our best vasodilator for our arteries. It promotes endothelial health and vascular health. And as we age, it goes away, and it can go away faster if you're not only aging, but you're also living an unhealthy lifestyle. Well, the baicalan help promote endothelial nitric oxide synthase, so help promote nitric oxide production in the blood vessels, promoting healthier blood vessels. That's huge for us, because you might remember from previous videos that there are not a ton of ways to promote nitric oxide, and here's another one added to our list. So in conclusion, baicalan may exert antioxidant effects by targeting NOX4, providing new mechanisms and insights to baicalan as a treatment for atherosclerosis. So we've got a human cell in a dish study. We've got live human diabetic study that is proof of concept, and there's lots of research in mice and rat models showing proof of concept. So if you're somebody that is dealing with metabolic syndrome, cardiovascular disease, or a family history of it, perhaps this is something you should have in your tool belt to help you offset the risk, in addition to changing the lifestyle. So cleaning up the diet, working on exercise and sleep and emotional health and toxic exposure, et cetera, et cetera. Let's open it up.
So you mentioned in the human study, the real human,
Yeah.
not just the cells. I think it's interesting that it elevates lactobacillus and bifidobacterium. Do you think, I know we're all into probiotics,
Mm-hmm.
a lot of people are. Do you think this would be a good thing to have in conjunction with probiotics? Or do you think this can kind of replace probiotics since it does elevate these beneficial bacteria?
Yeah, good question. I think it could play both roles. As redundant as my answer is, it depends on the person, right? And so, say you're somebody that I tell patients, if you want to improve your probiotic, you can take probiotics that will help seed the gut with them. But ultimately, if you want those probiotics to colonize and bloom out, you really need to be taking in sufficient and diverse sources of fiber, because the fiber is the prebiotic that feeds the probiotics, right? So it's the food for the probiotics. So between the two, if I could just choose one, for most people, I would say, well, just improve your fiber consumption and diversity so that you can feed what's there and allow them to bloom out. Now, what if you're someone who maybe you have to be low FODMAP because fibers light you up? Okay, well, maybe now we could pair some Chinese skullcap with, their probiotics and help them bloom out that way, and do our best with the fibers in the short term. Obviously, long term, we have to get them to be able to eat and tolerate fibers, but maybe in the short term, we can support abundance of probiotics with the Chinese skullcap in addition to the probiotics.
Now, would this be something to use, let's say, after colonoscopy, after, they clear everything out, and just to get back the beneficial ones?
Again, I don't think that's a bad strategy. In that instance, I would, unless there was a case specific reason not to, I'd say do all three.
Okay.
Take probiotics, increase your fiber, and do a course of this to really help yourself have the best shot at
Interesting.
repleting them as quickly as you can.
Yeah, thank you.
Yeah, you're welcome. And in that case, I'd also probably say get some probiotic yeast, so some Saccharomyces boulardii as well, because that helps outcompete potentially pathogenic yeast, which, like Candida, which acts as a squatter. So if you go get a colonoscopy and you mess up your microbiome, like research shows it does, then you have open real estate, and that's prime real estate for an opportunist like Candida to colonize. Well, probiotic yeast like Saccharomyces boulardii will outcompete them and kind of be a placeholder for you while you're bringing the probiotics back, the bacteria back.
Would this be a supplement that if somebody did have metabolic syndrome and they took it and they had good results with it, would it be something that they would need to take the rest of their life, or just until they get their system to where it needs to be?
I think it would be more of a get the system where it needs to be, assuming that once it's where it needs to be, the person continues the lifestyle that helped create that change, right?
Right.
Yep.
Okay, thank you.
Mm-hmm.